Science tells us that cancer is a disease of cells, but it's really a disease of people, whole people, and their loved ones. When my wife first got cancer, she was 36 years old, and we had 3 young children. We quickly learned just how the diagnosis affects mind, body, and spirit, how its effects spread to friends and colleagues, communities, and countries, how it generates fear and focus, how it influences the perception of our shared future, how it confronts us with death and forces us to face and often find what is most important in life, to find what matters most, and better ways to heal. Since then, I have cared for patients with cancer, both as their primary care doctor before and after the diagnosis, and as a consultant for many cancer patients under the care of oncology teams. I have, like most physicians, seen patients who refused conventional care die, some who only did conventional care die. I have also seen similar patients in both categories stay alive and thrive. In all cases, patients and their care teams needed the time and tools to look wider than they usually did and help in making decisions that best fit everyone's needs. Some conversations were gentle and guiding. Some were frank and difficult. In all cases, what works best is to bring in the science, hold out realistic hope, and guide people toward decisions where they feel comfortable and empowered. In my practice, I aim to hold a space for healing always, curing sometimes, with patience and compassion as often as I can.